So are your cholesterols really that dangerous? Are they increasing your risk of having heart disease? And do you use them actually in the rest of your body? Of course you do. Your cholesterols are used in your sex hormones. So your testosterone, your estrogen, your progesterone, all those use cholesterol. Your brain also uses cholesterol. And that's why some people, when they take cholesterol medication, they start having lots of symptoms. They might have joint pain or muscle pain, but they also might start having foggy thinking or affect their cognitive function, called statin brain, because cholesterols affect, of course, your brain. And then also, cholesterols also affect your immune system and all kinds of different processes in the body. But definitely those that have lower cholesterols tend to have an immune systems that are just not that great. So your cholesterols do affect your entire body. But so many times patients will come in, they say, well, I've got high cholesterol. Well, your total cholesterol, is that really that dangerous, just having high cholesterol? So many people, when you look at an artery, they have a concern, and so do I, that they may have plaquing inside of their artery. And that plaquing in the artery can obstruct blood flow and isn't good for somebody. We know that plaquing, a component of plaquing, is, of course, cholesterol. It's true. There's proteins in there as well, and there's also minerals. There's lots of things that are in plaquing besides just cholesterol. But remember this, there are some people that have a 300 cholesterol their entire life, and they never have heart disease. And there are other people that have 120 cholesterol, and they're having heart stents being placed in a couple times a year. And that's true. So there's something else different between these two presentations. That's why there's certain types of tests, such as lipoprotein testing or cholesterol particle size testing, that a person can have done to actually give you a true indicator whether or not your cholesterols are dangerous or not. The total cholesterol, the health fair cholesterol tests you have done, that's old research. That's not new research. That's old research, developed in the 80s and before then. But we know now that there's something different. There's something extra to investigate and look at to actually determine whether you truly have risk. So you might be an individual that actually makes all large size particles. Your LDLs could also be very large, and you might have large HDLs. Or you might make all small LDLs and small HDLs. Well, if you make all small size particle LDLs, those small particles can become a part of that plaquing. But if you make all large size particle LDLs, it can't become a part of that plaquing. The risk associated with those particles, those LDL particles, are not risky. So that's why some people, like I said, can have a 300 cholesterol and they have very, 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 very low risk due to their cholesterol. And then they start taking cholesterol medication, but the risk regarding cholesterol was not bad to begin with. So then they start having symptoms over here because they're artificially changing their cholesterol values in their body, and it creates symptoms even though they don't really have any risk. And then you have other patients that truly they're either low to begin with, or they've artificially brought their cholesterol levels down really low. Yet they're having heart stents being put in because they're not addressing the root cause of why this inflammation down here in the artery, why this inflammation is actually occurring. And that's why I say there are other tests, such as lipoprotein testing, such as LP, little a, and other lipoprotein testing that can get to the root cause and actually find whether or not you have a cholesterol issue that is encouraging this inflammation that's occurring there. If you do have LP little a, which is it's just a type of lipoprotein or cholesterol type test you can have done basically. But if you do have that, you have a 3 times the risk of cardiovascular disease if you have that number high. And I guarantee you, I mentioned this on our Facebook page before, if your number that number right there, that value is going to start being used a whole lot more so. You're going to see that at some point, whether that's this year, next year, or 10 years or 15 years. Providers are going to start doing that because there's enough research showing, because that's the point. Cholesterol totals themselves are not the end conversation, because just bringing down cholesterols can create other symptoms and problems if there's no risk associated with them. And the true risk, actually doing your cholesterol particle size testing, tells you whether your cholesterols actually have risk. If you do have inflammation that's occurring here, and of course you can measure those things, sometimes that's also related to other factors, other things that are causing the inflammation in the artery, which might be high homocysteine levels. That might also be because somebody's B12 status is low. That might be because their omega-3 fatty acids are lower. It's important to understand that when we start talking about plaquing, there's multiple things that can contribute to that. And we see routinely every day, we see patients that have low omega-3s, that have low B12 status. They also have maybe their homocysteine status is off, and also that their vitamin D levels are also low. Getting to root causes of problems is important, and just lowering your cholesterol levels when you're not actually addressing this inflammation that is potentially present, you're not really dealing with the root cause of it. And that's what we do here. We are offering a free heart health screening this month, which is an EKG and looking at basic vitals, looking at your blood pressure, etc., which is good for heart health month. But what you should probably be investigating too is looking at also your cholesterol particle sizes and your lipoprotein testing, your deficiency status, because those are the true preventative issues. Truly, is your cholesterol high? Is it causing risk? You don't know unless you test. And that's what we do here. We've got special IV specials are going on this month for Heart Health Month as well. And please take part in also our heart health screening, which is free for you to take part in. And so give our office a call and we'll help you out as best we can. And so give us our office call at area code 402-463-4257 and have a blessed day.